Hello everyone, I'm Anita Wallace, I'm Chair of the Lymphedema Support Network, and I'm delighted to introduce you to Professor Dominic Furniss, a microsurgeon with a special interest in lymphedema. It's another interesting question, although it's not a specific question about lymphedema surgery. This person wants to know, why is it that surgeons generally are not more aware of the lymphatic system and how what they are doing might damage it, so as to be more careful?
So, good question, interesting question. I think I'm going to have to be part of the surgeons union and say, I think the surgeons who are dealing with lymphatics day in, day out, and by this I mean cancer surgeons, so be that urologists or gynecologists or breast surgeons, they're probably the three most common surgeons who deal with this. Plastic surgeons as well, dealing with doing lymph node dissections, etc. They are aware of the lymphatic system. They do know what it does, and they do know that by doing these operations, they are damaging it. However, they have to do these operations. They're not doing them because it's fun to do them or anything like that. They're doing them primarily because they're treating cancer. And it's important that surgery is part of the armamentarium we have in order to try to cure a cancer. And don't forget, it's not just surgeons, it's radiotherapy as well. So treatment of lymph nodes by radiotherapy also damages those lymph nodes very deliberately, because it's trying to destroy the cancer cells that are within them in order to stop that cancer from spreading any further. So it's often a necessary evil. However, I'm going to take my surgeons union hat off now and say, whilst they understand that, my feeling is that not just surgeons, but radiotherapists and oncologists as well, they don't give enough weight to lymphedema. They don't give enough thought to how this affects the person's life after their cancer treatment. So very often I've had people come to my clinic who said, having lymphedema is worse than having cancer.
Oh, definitely.
And very often, yep, it's very common. And also very commonly, I've had people come to the clinic and say, I showed my surgeon my swollen leg or my swollen arm, and their response was, well, at least you don't have cancer. And to my mind, that is just very, you know, I can barely believe that people say that.
Oh, they do, Dominic, believe me.
But it just demonstrates such a lack of empathy with the patient and such a lack of care for that that patient and how this is affecting their lives.
Yeah.
And so yes, I agree that surgeons do need, and oncologists as well, and radiotherapists as well, do need more education about lymphedema and about how lymphedema affects the quality of life of their patients. I think in some circumstances, they see lymphedema almost as a complication of their treatment. And I desperately try to get them out of this mindset whenever I'm speaking to surgeons about this, or to oncologists about this. I don't think they should see it as a complication of their treatment. It's a consequence of their treatment. Their treatment is absolutely necessary, as we've said. And this is just one of the unfortunate things that can happen. And again, it doesn't happen in everyone. Maybe 20 to 30% of people who have their lymph glands treated go on to get lymphedema. And if they see it more as a consequence, then I think they would be more happy to acknowledge it and to think about how to treat it and manage it more rapidly. And I don't want to tar everyone with the same brush as well, because there are some very forward-thinking surgeons and oncologists and radiotherapists who, you know, work really closely with their local lymphedema services, and some who refer to us very early in the process, so that people are able to make the choice of whether they would like to have a surgical solution to their lymphedema as well. So, you know, there are some enlightened people out there, but I agree it would be nice to be able to get this message over about it being a consequence and what effect this has on patients' quality of life, so that they can explore other treatment options and try and improve their quality of life.
Absolutely. Well, thank you, Dominic. I'm very grateful for the time you've given us. That's the last of our questions in this series, but thank you very much.
It's been a great pleasure, Anita, and thank you to your members for such interesting diverse questions.
They're varied. Yes,
yeah,
lovely.
Absolutely. I've really enjoyed it. Thank you.
Good. So bye. Thank you.